Okay, so good afternoon, everyone. I am Michela Bertoola, a veterinarian and researcher for the National Reference Center for Beekeeping here in Istituto Zooprofilattico Sperimentale di Venezia in Italy. First of all, I would like to thank Maria for this opportunity and this event. I can imagine how hard it was today, so thank you, Maria, really. Today, I will be brief, so don't worry. I try to address some emerging challenge and endemic honeybee threats in Italy, focusing on surveillance, control, and regulatory aspects. So first of all, just a brief introduction of my institute. We are a public health veterinarian institute working on animal health, food safety, and animal welfare. Regarding bee, we perform field monitoring and field tests and laboratory analysis, both on bee pathogens and chemicals of the honeybee products. And lastly, we perform also in vivo tests in bees and on mites. Italy ranks third in terms of beekeepers and counts almost 2 million honeybee colonies. But recently, new critical hotspots has emerged for the spread of honeybee disease, pests, and predators. In particular, today we will address this. So, Varroa destructor, 3 hornet species, and Echina tumida. Just for the American food broad, it's just endemic, but actually we do not have updated data. So let's start with Varroa. Varroa arrived in Italy in 1981, and the Ministry of Health just immediately issued a regulation recommending colony monitoring, preventive measures, and emergency action, like culling the colonies. But despite them, in a few years, Varroa was reported in all the Italian provinces, and only in 1995 there was the national recognition of the widespread of this infestation, and was mandatory the disinfestation or the hive destruction, but only in case of severe infestation. This was maintained till 2013, when a structured, integrated, and coordinated management approach was established for prevention, monitoring, and treatment of varrosis. And today we have these national guidelines that are updated yearly based on the epidemiological surveillance, but also based on environmental data, where we list all the veterinary medical products that beekeepers can use in Italy and how to use them properly. And we recommend at least 2 treatments during the year. For the EU regulatory framework, and so for the animal health law and related regulation, Varroa falls under is a listed disease and fall under category C, D, and E. So it's relevant for some part of the Union. We have to prevent its spread across between member states, and surveillance is needed. Then, Echina tumida. Echina tumida in Italy is well established in Calabria region since 2014, and while in Sicily we have isolated outbreaks in 2014 and 19, and now we have a more consistent outbreaks that began last year and is still ongoing. For the rest of the country, these beetles is exotic, so their presence for now has not been reported. For the EU framework, small leaf beetles is a listed disease falling under category D and E. So we must prevent its spread to the other member states, and we have to perform surveillance. And for these reasons, we have a national surveillance program divided in 3 sub-programs. So one for the regions where there is no beetle for now, one for Calabria region, and one for Sicily region. And only thanks to this structured and capillary surveillance system, and only thanks to the constant data reporting at the EU level, only Calabria and Sicily are under restriction for the movement and exchange of the MB products, while the rest of territory is free. Then the 3 hornets, so Vespa crabro, orientalis, and Velutina nigritorax. We have all of them in Italy. Here, just to show you some morphological differences in terms of shape and colors, patterns of abdomen and head, and different dimension and characteristics. These 3 hornet species are classified differently. Vespa crabro is considered a native species and is widespread through the national territory. Vespa orientalis is native, like Vespa crabro, in the southern part of Italy, but recently, like since last few years, it has shown some neo-invasive characteristics. And actually, it is spread through the north part of Italy till reaching Friuli-Venezia Giulia, so the region that borders with Slovenia and Croatia. While Vespa velutina is considered an invasive species, so it arrived in 2012 in Liguria and start its expansion to the south and the east part of Italy. For the native species, there's no regulation in Italy, while for Vespa velutina, you can see here listed all the regulation, both national and European ones. Just 2 key points for the alien species regulation. The regulation for invasive alien species does not apply to pathogens that cause animal disease. Therefore, small F beetle and Tropilelaps, formally for the EU framework, are listed like listed disease, are reported, classified like listed disease, as listed disease, but not invasive alien species. And then, for implement and create regulation, practical one for these invasive alien species, there is the need of a risk assessment based on the scientific base. And as for today, there's no this risk assessment in Italy for Vespa velutina, so actions are very limited for its control. But what we have to do? How we have to act in case of an outbreak of Tropilelaps mite? At the present day, Tropilelaps is a listed disease, category D and E, but is exotic for the Union, so it means that it is not present in the European Union. Of course, there are 4 species in this genus, and we have to focus on Tropilelaps mercedese and clare, because they can parasite Apis mellifera. Here, just to see the color, shape, and dimension different from Tropilelaps on the left and from Varroa to the right. And this is the distribution map of Tropilelaps in Asia, so in the native range. But recently, Tropilelaps was reported in the western Russia, here in the Krasnodar region, then in Georgia, here, so in, sorry for my pronunciation, but it's Samer Grelozemo Zvaniti region. But then we have more recent updates that show us that Tropilelaps arrived and is established also in Belarus and in Crimea. So how we have to move? For sure, beekeepers that are like capillary in all Europe, they must maintain healthy colonies and implement biosecurity practice. Veterinary service must remain equipped and responsive. Research, coordinated research at the EU level is needed and is urgent to have it. Then we have to create a coordinated and effective surveillance and reporting system focusing on rapid alert and early reaction measures. Because only if we start the outbreaks on the beginning, we can stop it. Otherwise, maybe it will be the same as Varroa. So I have finished. I will thank you.